Hi, and welcome to this week's video podcast. I'm Brent Dodge, owner of Alpine Physical Therapy. This week we're going to be talking about an interesting topic called IASTM. We'll refer to it as IASTM, which means Instrumented Assisted Soft Tissue Mobilization. And I have with me Brace Hayden. Brace is a doctorate in physical therapy here at Alpine Physical Therapy. Got his undergraduate at University of Puget Sound, go UPS, that's my alma mater as well. And he went on to get his doctorate at Slippery Rock University in Slippery Rock, Pennsylvania. Brace, we're glad you're here.
Thanks, Brent.
You know, Brace, there's been this talk about IASTM, and I think I'd like for our viewers to understand what that is and kind of where it came from, and if you can help us understand IASTM, that'd be awesome.
Thanks. So IASTM has been around for hundreds and hundreds of years. It's essentially been around as long as massage has been used as a technique to facilitate healing. Using an instrument it dates back to ancient China. It was a technique known as gui shi, and where they would use the edge of a coin or a ceramic spoon or possibly a rock to firmly glide or scrape across soft tissue, muscle, tendon, fascia to facilitate or get a healing process kind of jump started.
So it's been around a long time. It seems like there's really been a lot of talk and maybe even a resurgence of the use of this type of technique in the United States and maybe even internationally. Can you talk to that effect?
I think as from the physical therapist perspective, we're always looking for techniques that are efficient, effective, and can get some kind of stagnant, stubborn tendon or muscle issues turned around. You know, people might have had tennis elbow for months up to a year, and it's sticking around, and looking for something that's non-surgical and effective to get this injury on the healing trend. And it's using a tool. We usually use something, this particular one, there's a lot of different tools on the market, but we're essentially using an instrument to glide or aggressively massage a muscle tissue to get tissues reorganized and on a healing trend.
You know, it's interesting because I was in a course in San Diego that really wasn't related to the use of IASTM, but we got talking about using various instruments to scrape along the skin, and the terms they used actually were gui shi, the ancient Chinese form of this. And I came back to the clinic and I was looking around for something that I could use. I actually ended up using the edge of a reflex hammer and got some pretty good results with that. And I do know that there are some schools of thought where they've incorporated various types of tools that go with the training. And here at Alpine, we're using the STAR tool, which you've got there, a pretty handy tool. Can you tell me what's going on when you are doing the scraping? What kind of happens in the body?
So there's a few different ways we see that the instrument can kind of facilitate it. First of all, we're using the instrument to detect problemed areas, essentially by gliding it across these. It picks up on kind of fibrotic or lumpy tissue areas that are typically the troublesome area, or where patients will say, yeah, that's where it hurts. And we're using it to break up these fibrous or scarred areas and help get the body to help absorb this tissue back in. It's also thought that by creating a kind of a microvascular little trauma area, which doesn't sound very pleasant, but in order to get things that have been unpleasant for a while turned around, you sometimes have to kind of get this aggressive technique in there to create this localized area of inflammation. And by doing that, we get the body to kind of kick in its own healing response that gets more circulation to it and gets the body to recognize that there is a problem in the area and to get going with that.
It's amazing because I've used it on people where, on one side there's really no nodules, no thickened areas, and as soon as you come into the problem area, the client can really feel like, whoa, there's a problem there. And you'd think, wow, this is going to be a really painful experience, and I think in some ways it can be unpleasant. but the response, when it's the right patient with the right treatment, I just get great results with it. So I'm really excited that you're really promoting IASTM here at Alpine and just really taking it to the next level. When you are scraping, obviously you're breaking up some adhesions. Is there anything else that you try to do with that tissue as you work the tool?
Yeah, so the thought is that you're not just repeatedly scraping or firmly massaging this one area, but we're kind of working the whole kinetic chain. Some of this is to get some blood flow into the area and kind of move this scar tissue down the road so that it's available for the body to massage. There's also some good documentation to say in the research that what we have here is a kind of a stagnating degenerative area of tissue that doesn't have the right cells in the makeup to really get healing going. And so by breaking up this scar tissue area, we're getting the body to recognize it. And the thought is that there's a pretty disorganized bundle often in scar tissue of this kind of fibrous area. And by getting some specific massaging techniques over this area, we're getting the body to reorganize the tissue and get it moved along on the healing road. And it is not just a treatment unto itself. We combine this with often afterwards stretching the area, making sure that if this muscle or tendon, we've massaged it, and we get people doing some specific stretches to kind of optimize the length of this. We'll address some other joint type things if there's some scarring or some limited joint mobility with some hands-on techniques to get the joint moving. We'll also look at if there's some strength or stability deficits in this area, working on some therapeutic exercises to address strength issues. And typically we'll end it as it is creating an inflammatory response. We'll end it with some cold treatment to kind of help ease the discomfort and get some localized anti-inflammatory type work on there.
You know, at first you think, wow, that's kind of wild. They're going to take this tool, you know, and they're going to rub that potentially down my arm or my leg, depending where the tendon or muscle problem is. It's almost counterintuitive to think that this tool is somehow going to help. But really, you know, you've got massage, and you can do a lot of good things with massage, but I find that the tool really helps to get into those problem areas and get some results. You know, we've talked a lot about things like in the forearm. One of the gals I had that really had a lot of these nodules. Are there other specific conditions that you find that are commonly treated effectively with this approach?
You know, yeah, time to time it's a nice tool to have in your kind of grab bag of approaches for getting these more stubborn, chronic-y things going. We see a lot of lateral epicondylitis or tennis elbow, where this that don't heal very fast on their own, or more medial type things like golfer's elbow or medial epicondyle issues, or Achilles tendonitis down here. And those are three that just come to mind, and we see a lot walking through the door that just aren't getting better on their own. And it is a really nice technique for getting something that's been sticking around for months or years on the way.
Well, it sounds like a very effective tool to have. Certainly it's not the answer for everything. No, we wouldn't want people walking in thinking, boy, they're going to put that tool on me. But in the right place at the right time, we've really seen some great results. We've gotten a lot of good information today on this unique technique called IASTM, and I want to thank Brace Hayden for being with us today.
Well, thank you, Brent, for having me.
You bet. Now, right now, I know you're waiting for the tip of the day.
So here's today's tip of the day. If you are suffering from some sort of chronic or stubborn musculotendon issue, you might consider IASTM as a way of getting this treated. So please consult your healthcare provider, your physical therapist, your physician, and they could get you a referral to get this treated with IASTM.
Thanks for joining us on this important topic, IASTM. For more information, be sure to visit our website, click on the Therapies link, and look for IASTM.